The curve is flattening here in Australia. We're seeing a reduction in the number of new infections being diagnosed. Of course, the new infections we're seeing relate to people who were infected a week or so ago. The measures that we have in place today, we'll see the impact of those occurring a week or so from now. But with the reduction in the number of new infections occurring around the country, the measures which the country has adopted and which Australians have picked up and performing so magnificently are having their impact.
What does the modelling show?
The modelling shows that rather than have a terrible uncontrolled epidemic, that what we have is a controlled epidemic with limited number of new infections. What we're seeing is not having a dramatic effect on our hospitals and our intensive care units. So we do have people, of course, in hospital. We do have people in intensive care, but those services are not being overwhelmed. And this is what we're aiming to do. This is what flattening the curve is all about, keeping the number of new infections down, keeping the number of people with very serious illness at the lowest level that we possibly can, and of course preventing the number of deaths that we can as well.
Were we ever on the Italy or United States trajectory?
I think it's unlikely that we're ever on a similar trajectory. Australia, as you know, was very quick. It was one of the first countries to start to restrict travellers, initially from China when the initial outbreak occurred in Wuhan, and then rapidly moving to close our borders, to restrict travel, and so we have had the advantage of being able to see what was happening, how the epidemic was rolling out in other countries. We learned the lessons from other countries, and those have been applied through the measures which are now in place right across Australia. But this is not a time for complacency. We don't know how this virus is going to react. We don't know what's going to happen in the future. The measures that we have currently in place are to protect each of us, to protect everyone in our community, to try and make sure that we continue to have the low level of new infections that we have, and to minimise the impact on our country. But we've all got to still be doing our best to stop the spread, make sure that we all stay safe.
The community transmissions are the ones that are really concerning health authorities like yourself. Is there a chance that a lot of these new infections can be passed on by asymptomatic patients?
So we're still learning a lot about the coronavirus, and we're learning a lot about how it infects people and what happens during the early phases of when someone's infected, before they start to exhibit the symptoms of fever, cough, shortness of breath, and so forth. And it may be with some people that there is the possibility that they may be at risk of spreading the virus to another person in the day or two before they actually develop symptoms themselves. And this, of course, is why we have in place the measures that we have in place. This is why we're being so conscious in making people think about washing their hands, not touching their face, maintaining that physical distance from other people. So if someone was asymptomatic and coughed, the risk of transmitting to another person would be very, very low, if at all. And so this is behind all the measures that we have in place, and this is protecting us all.
Professor, just finally, are there different strains of this virus, more vicious strains that you've identified in Australia or elsewhere?
So this is obviously one of the family of coronaviruses, and there are other strains of the coronavirus which we've experienced before with SARS and the Middle Eastern Respiratory Syndrome, which are very nasty infections as well. This particular virus, which is in Australia at the moment, we haven't seen additional strains, but there is a lot of research going on to look and see, is it possible that this virus may mutate, that it may be that someone who has been infected with the virus, if the virus changes, would they still be immune, or would they be at risk of being infected once again? These are questions that we simply do not know the answer to. Remember, we're only into the 4th month of our history of living on the planet with this virus, and so our researchers here in Australia, and we have some of the best health and medical researchers in the world who are devoting their time to try and solve some of the riddles, some of the puzzles which are behind this particular virus, to help us to better understand it, and that way to better modify the way that we're treating the virus, the way that we're implementing our public health measures, and of course knowledge which we hope to be able to share with the rest of the world as rapidly as possible.